If you are over 60, there is a silent threat inside your body right now. One you cannot feel, cannot see, and often discover only when it's too late. Every 40 seconds, an American suffers a heart attack. And here's the most frightening part. More than 80% of heart attacks in seniors are caused by gradual artery blockage, not sudden events. But what if I told you that something as simple as what you drink each day could dramatically prevent this risk? My name is Dr. Michael Carter. In this channel, I break down what the world's leading doctors and scientists are discovering about elderly health. So instead of going through hundreds of confusing studies or videos, you can understand the most important, proven insights in one place and act before it's too late. Stay with me until the end, because today I'll share 5 powerful drinks, backed by recent scientific findings and clinical experience, that help clean arteries, reduce inflammation, and protect your heart naturally after 60. Before we continue, please comment below your age and tell me, are you more concerned about heart health, gut health, or brain health? My team and I read every comment and reply personally. To truly protect your heart, you must understand why heart attacks happen in the first place, because you know your body better than any doctor. A heart attack is not sudden. It doesn't start in the hospital. It starts years earlier inside your arteries. As we age, fatty substances, damaged cholesterol particles, and inflammatory waste begin sticking to the inner walls of blood vessels. Over time, this buildup narrows the artery, like rust inside an old water pipe. When blood can't flow freely, the heart muscle becomes starved of oxygen. Eventually, a small blood clot forms on top of this blockage. That single moment can completely stop blood flow, and that is what causes a heart attack. What's shocking is this. Many seniors who suffer heart attacks do not have extremely high cholesterol numbers. Modern research shows that the real danger is cholesterol oxidation and chronic inflammation, not cholesterol alone. This is exactly why the right natural drinks can make such a powerful difference. Let me explain this in a way my patients understand instantly. Inside your arteries is a delicate lining called the endothelium. When you're young, it's smooth and flexible, but after 60, things begin to change. Years of high blood sugar, processed foods, chronic stress, low-grade inflammation damage this lining. Once damaged, LDL cholesterol becomes oxidized, meaning it turns toxic. This oxidized cholesterol sticks to artery walls like wet cement. Your immune system tries to fix the problem by sending inflammatory cells. But instead of healing, this creates plaque, a thick, hardened substance that narrows blood flow. Even worse, this plaque becomes unstable. One small rupture is enough to trigger a clot, and that clot can block blood flow to the heart entirely. This is why simply lowering cholesterol is not enough. According to recent research, the real solution is to prevent cholesterol oxidation, reduce inflammation, relax and widen blood vessels naturally. And this is exactly where the right drinks make a life-changing difference. If this information is helping you, please like this video and subscribe. It helps us reach more seniors who deserve a longer, healthier life. Now that you clearly understand why arteries clog and how heart attacks silently develop over the years, it's time to focus on solutions that actually work in real life. These are not trendy internet remedies. These are drinks I've personally seen help seniors improve blood flow, reduce inflammation, and protect their hearts naturally. Drink number 5. Garlic, ginger, lemon water. This combination works like a magic. This combination works at the root cause of heart attacks: oxidized cholesterol, inflammation, and poor circulation. Garlic contains allicin and sulfur compounds that prevent cholesterol from oxidizing, which is the first step of plaque formation. It also relaxes blood vessels and helps lower blood pressure. Ginger contains gingerol, a powerful anti-inflammatory compound that calms irritated artery walls. Lemon is rich in vitamin C and flavonoids, which improve blood vessel flexibility, increase nitric oxide, and support healthy blood flow. Together, these three ingredients create a powerful daily protection for aging arteries. This drink reduces inflammation inside the artery walls, prevents cholesterol from becoming sticky and dangerous, and gently widens blood vessels so blood can flow freely. Modern research now confirms that stopping cholesterol oxidation and inflammation is far more important than simply lowering cholesterol numbers. How to prepare it? Take 5 to 6 garlic cloves and 1 inch of peeled ginger. Mash them together and add them to 1 liter of water. Boil for 5 to 7 minutes. Let the water cool to room temperature, then add the juice of 1 whole lemon. Mix well and store it in a glass container in the refrigerator. How to use it safely? Drink about 50 milliliters once a day. The best time is in the morning on an empty stomach. If your stomach is sensitive, you can take it 1 hour after breakfast. Use it for 3 weeks, then take a 1-week break before repeating. Margaret, a 68-year-old retired teacher, came to me frightened after being told she might need bypass surgery. She started this drink daily. Within 6 weeks, her inflammation markers improved, her blood pressure stabilized, and her energy returned. A year later, her cardiologist confirmed there was no further plaque progression. She avoided surgery and regained peace of mind. Drink number 4. Fenugreek seed water. The second drink targets 2 silent heart enemies most seniors overlook: unstable blood sugar and high cholesterol. Blood sugar spikes damage artery walls and make plaque formation faster. Fenugreek seeds contain soluble fiber and plant compounds that reduce LDL cholesterol, stabilize blood sugar, improve gut health, and lower overall inflammation. A healthier gut directly leads to healthier arteries and a stronger heart. Fenugreek slows sugar absorption, prevents insulin spikes, and reduces cholesterol absorption in the gut. This reduces damage to artery walls and lowers long-term heart risk. How to prepare fenugreek water? Take 1 to 2 teaspoons of fenugreek seeds and soak them in warm water overnight. In the morning, strain the water and drink it. How to use it? Drink fenugreek water first thing in the morning on an empty stomach. For best results, chew the soaked seeds later in the day when comfortable. The taste may be bitter, but the benefits are powerful. George, a 71-year-old veteran, struggled with rising blood sugar and cholesterol. Medications upset his stomach. After 8 weeks of daily fenugreek water, his blood sugar stabilized, cholesterol improved, digestion felt better, and his energy returned. He told me he finally felt in control of his health again. Important safety note: introduce only 1 drink at a time and stay consistent. If you have bleeding disorders, be cautious with garlic. Natural remedies are powerful when used correctly and patiently. Drink number 3. Triphala drink. Triphala is one of the most trusted herbal combinations I've used in elderly patients. It is made from 3 fruits, including amla, which is one of the richest natural sources of vitamin C. Triphala works by cleaning the digestive tract, supporting liver function, and improving how the body handles fats and cholesterol. When the gut and liver are clean, cholesterol balance improves naturally, and inflammation levels drop throughout the body. This drink reduces toxin buildup, improves digestion, supports healthy cholesterol metabolism, and lowers oxidative stress. A healthier gut directly leads to calmer arteries and better heart protection. How to use Triphala safely? Start with half a teaspoon of Triphala powder at night before sleep. You can mix it with warm water or take the powder followed by water. If you feel good the next morning, this dose is enough. If not, increase to 1 teaspoon. Some seniors may experience loose stools initially, which is why starting low is important. Evelyn, a 70-year-old grandmother, struggled with constipation, fatigue, and rising cholesterol. After 4 weeks of triphala at night, her digestion normalized, her energy improved, and her cholesterol numbers moved in the right direction. She told me she felt lighter and more active than she had in years. Drink number 2. Turmeric with black pepper water. Turmeric contains curcumin, one of the most researched natural anti-inflammatory compounds in the world. Chronic inflammation stiffens arteries and accelerates plaque formation. Turmeric helps restore flexibility to blood vessels and protects the inner artery lining. When combined with black pepper, curcumin absorption increases dramatically. This drink reduces systemic inflammation, supports healthy cholesterol levels, improves endothelial function, and helps maintain elastic arteries. Many researchers now believe inflammation control is just as important as cholesterol management for preventing heart attacks after 60. How to prepare and use it. Take 1/4 teaspoon of turmeric powder, add it to a glass of warm water, and add a pinch of black pepper. Drink this at night before sleep. You can also include turmeric regularly in your cooking for added benefits. Robert, a 66-year-old former construction worker, suffered from joint pain, high cholesterol, and early signs of arterial stiffness. After adding turmeric water at night, his inflammation markers improved, his joint pain eased, and his blood pressure became more stable within 2 months. Drink number 1. Arjuna bark water. Arjuna is one of the most powerful heart-supporting herbs used for centuries. In traditional practice, no heart formula is considered complete without it. Arjuna strengthens the heart muscle, supports healthy blood pressure, lowers LDL cholesterol, and protects against oxidative stress. Arjuna contains natural antioxidants, flavonoids, calcium, magnesium, and zinc, nutrients essential for strong heart contractions and steady rhythm. It doesn't just protect arteries, it strengthens the heart itself. How to prepare and use Arjuna water. Take 1 teaspoon of Arjuna powder and add it to a glass of water. Simmer on low heat for 3 to 5 minutes. Strain and drink it warm. You may add lemon juice or a little honey if needed. Take it in the morning on an empty stomach, or 1 hour after breakfast if your stomach is sensitive. Harold, a 73-year-old retired engineer, experienced frequent fatigue and irregular heartbeats. After 6 weeks of Arjuna water, his endurance improved, his heartbeat felt steadier, and his cardiologist noted better overall heart function. How to rotate the C. Drinks is very important. I recommend using 1 drink per week, rotating weekly. This prevents the body from adapting and keeps benefits strong. Follow this routine for 40 to 60 days, along with a heart-friendly diet. Important cautions. If you have a bleeding disorder, be cautious with garlic. If you have gallbladder stones, use turmeric carefully. Always listen to your body and introduce changes slowly. By now, you understand something most seniors are never told. Heart attacks don't begin in the emergency room. They begin quietly, years earlier, with inflammation, oxidized cholesterol, and stiff blood vessels. The good news is that these processes are not fixed. They can be slowed, and in many cases improved, with simple daily habits. The 5 drinks you've learned today work together to support clean arteries, calm inflammation, balance cholesterol and blood sugar, and strengthen the heart muscle itself. How to follow this safely and simply. You do not need to use all 5 drinks every day. In fact, I recommend rotating them weekly, 1 drink per week. Follow this routine for 40 to 60 days. Pair it with simple lifestyle choices like walking daily, managing stress, and reducing processed foods. This approach is gentle, affordable, and sustainable for seniors. Many of my patients tell me the same thing. They wish they had known this earlier. Hospital stays, procedures, and lifelong medications cost thousands of dollars, and often come after irreversible damage. These drinks cost very little, yet they support the body's natural ability to heal and protect itself. Prevention is always cheaper, safer, and more powerful than treatment. After 35 years of treating elderly patients, I can tell you this with certainty. Aging does not mean waiting for disease. Your heart is resilient. It responds to care, nourishment, and consistency, no matter your age. What you choose to drink each day may seem small, but over time, it can mean the difference between fear and confidence, between illness and independence. If this series helped you, please subscribe to this channel, like this video, and share it with someone you love who is over 60. You never know whose life you might help protect. And remember, your heart has carried you this far. Now it's your turn to take care of it.